Vista's data analytics platform lets you look at 40 different patient-reported metrics by program, by clinician, and by time period. This is the patient progress chart. What you can see is that 70% of the patients came in reporting being moderately or severely depressed. And by the time they left treatment, this had dropped to 9%. You can see this information for all of the different types of mental disorders that you're monitoring patients for. You can see the improvement during treatment in suicidality and also in eating disorders. You can look at program completion and see that 64% of your patients are completing all recommended treatment and another 9% completing at least one level of care. Unfortunately, 15% are leaving AMA. You can see the level of patient satisfaction with treatment, and for patients about to leave treatment, were they asked about their treatment goals and were their treatment goals met? But there's a lot of other information here besides. You can look at primary drug of choice, addiction severity, and how you read this is that the dark red bar, those patients were reporting having all 11 of the DSM-5 symptoms of substance use disorder in the year prior to entering treatment. You can see what percentage of your patients say that they will do whatever it takes to meet their drug and alcohol treatment goals. There's information on the number of previous substance use disorder treatment and whether patients are taking medication. The demographics page allows you to look at your patient population by gender, age, and what brought them to treatment. You can see what percentage were living in a stable living environment prior to treatment and how many were gainfully employed or going to school. You can also see where in the country your patients are coming from. There are 8 different data analytics tabs, all of which you can analyze by program, by clinician, and by date. The patient's comments tab, you can actually even analyze by satisfaction level of the patient. So if you want to dive in and see, is there an issue in one of your programs that is starting to get patients very dissatisfied, you can hopefully identify that very quickly. So I think you can see that the data analytics platform allows you to pretty easily see what your center is doing well, and also to identify some potential areas for improvement, as well as seeing changes in your patient population over time.